streaming surgery called the Deuk laser disc repair at C4-5 and C5-6 on the patient's cervical neck. I will show you guys a video about why people have neck pain right here. So Dr. Deuk will start his surgery soon, and I'll give you guys a heads up. Thank you so much.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com. Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com. Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the
You are now live.
Hello there, this is Dr. Ara Deuk-Majan at the Deuk Spine Institute. Give me an AP, give me an AP. We are getting ready to do an anterior cervical Deuk laser disc repair. See 2, 3, 4, 5, 6. We're going to start, it's perfect lateral. We're going to start at C5-6. Sean? Sean? And I just need a minute to, Sean, get to where we need to be. Sean? All right, let's get an AP and verify we're in the right spot. So the beginning of the surgery, this is endoscopic spine surgery. This is state-of-the-art spine surgery you're going to watch. It's not done very many places in the world. In the United States, Deuk Spine Institute's the only place, lateral. And to start with, we're going to access the discs that we're treating, which are the 4-5 and 5-6 cervical, through with a needle going through the skin. And we're going to do a discogram. A discogram is where I inject dye into the middle of the disc and I look for leaks and tears. That's where the herniation would be. How's our blood pressure? Is good? 2, 3, 4, 5, 6. All right, shot. Bam. So it's mostly up through the front there. I'm going to go a little bit deeper. Shot. I'm going to inject more posterior. Shot. All right. So you can actually see the herniation in the back. Would you show them that herniation? Stay on the fluoro. Show them the herniation there, please. Monica, that's you. Oh, very nice. Right there. You see that bulging out there?
Yes.
That is the herniation. And the dye is kind of getting in there, and you can see the dye on the x-ray. Of course, it's also leaking out the front of the disc, which we don't care so much about. That will go away. It'll be absorbed by the body. All right, very good. Happy with the discogram. Oh, you want to do a quick AP as well? Coker? Yes. Lou Gardens. Is that what it is you said? Lou Gardens. Yep, you got it. That is where you guys have to go. Harry P. Lou Gardens. That's it. Hey, can you put a link to that? Because anybody watching should go check it out in Orlando, lateral. Yeah, the Harry P. Lou Gardens in Orlando. It's Winter Park, right? Or Lake Mary, Winter. It just says Orlando. Okay. Well,
I'll put a link in the chat.
awesome, awesome. All right. So, we're just talking about, since it's Christmas, one of the gardens in Orlando is beautifully decorated, and a lot of people go, but you need to make a reservation. Okay, so right now we are looking at the lateral view. I've counted the bones, 2, 3, 4, 5, 6. You have to see C2, which is the tall one at the top. We are at C5-6. We're going to start with the C5-6, and then we're going to go fix the C4-5 afterwards. I've got my guide wire in. I'm going to remove the needle. Our patient is asleep. They have a tube down their throat. They're intubated. Surgery is done under general endotracheal anesthesia. This is spine surgery. I am a neurosurgeon, a board certified neurosurgeon. Shot. And we're doing a surgery that departs from traditional fusion or artificial discs, which have become popular in the last 20 years in the United States. And of course, before that, in Europe, artificial disc surgery was done for 20 years before it started being done in the United States. But the FDA approval started coming in for lumbar artificial disc, then cervical, back in the early 2000s, like 2002, 2003, 4, 5. And now artificial discs are being done more commonly alongside ACDF fusions. But this is the newest and best surgery. It's done endoscopically. There is no metal, there's no fusion, there's no artificial disc. We don't go to the hospital. This is done outpatient. The surgery will take an hour and the patient will recover for an hour, then go home. And it's all done with a 4mm incision. So I'm about to make that incision. I've infiltrated the skin with a little bit of lidocaine marcaine. Now, the surgery is called the Deuk laser disc repair because we pioneered the surgery here at Deuk Spine. As a matter of fact, I pioneered it at Deuk Spine, started doing it about 15 years ago. To date, we've done 1,400 plus surgeries in the neck, thoracic, and lower back, the most common being the lower back. Cervical disc herniation surgery with the endoscope is the second most common, and then thoracic is the third. We only started doing thoracic about 2 years ago, Sean. I've done about 12 or 13 now. And every one of them that we've done, we've had 100% pain relief in the patients. The last patient we did was an Australian patient, and he's in Australia, and he had 100% relief of his thoracic pain. Sean? Now you can see I'm bringing the dilator down. The dilator is around 3 millimeters, 3.2 millimeters. It's the same width as the internal diameter of the tube that we're going to do the whole surgery through. Shot. And as I'm bringing this down to the disc, I'm making sure that I'm not bringing the guide wire tip further back. It can go back another centimeter safely. You can see it's right at the beginning of the herniation. If you look at the back of the disc, it's C5-6. But I don't want it to go into the spinal cord, which is behind the disc herniation. So we're just very careful about that. Okay, I'm up against the front of the disc where the anterior longitudinal ligament is. I'm going to get an AP, make sure I like my positioning of the tip of the dilator. The tip of the dilator needs to be somewhere along the ALL, anterior longitudinal ligament, between the longus colli muscles. The longus colli muscles sit in the front of the spine. That's absolutely perfect. We're dead center. Let's go back lateral. The longus colli muscles sit on the sides of the front of the spine, and we'd rather not go through them. And there's about 1 centimeter to 1.5 centimeters, like a red carpet that you walk down right between those longus colli muscles. And that's where we are. We're on the red carpet. And by staying on that space, we stay out of the longus colli muscles, we avoid bleeding, and we avoid injury to the sympathetic trunk, which can cause a Horner syndrome, an abnormal pupil and droopy eyelid, things like that. We don't want. Sean? All right, so I'm starting to twist and advance this dilator into the disc. Now we're not doing any damage whatsoever to the patient's body, except for the skin cut we just did. That skin cut's 4 millimeters. It's tiny. It's like a boil. And it's going to leave virtually no scar by the time we're done. All right, I'm into the disc. I can feel it. I'm through the ALL. I'm going to take my guide wire out, and I'm going to gently and carefully advance this dilator through the disc. Shot? I'm going to use this mallet to do that. I just went through the annulus. I could feel it give way. I'm in the jelly part of the disc called the nucleus. We're going to the back of the disc where the herniation is. Okay, and you know, you can actually feel things going where they're supposed to. Sometimes if the disc is super collapsed, it's a little harder, but I'm going right into that herniation. Shot? You gotta sometimes, you know, give a little pressure here or there on the dilator to direct it to where you want it, so you're not scraping along the end plate, bringing up cartilage. All right, we're pretty close. I want to go about 6 millimeters more. Sean? Any questions from our audience?
No questions, but we have a viewer who's wishing everyone a very happy holidays.
Thank you. And we wish all of you a happy holiday. So for those of you watching, we live stream these surgeries so that the public can learn about spine surgery and advances in spine surgery. You won't see this anywhere else in the world. This is a full surgery, unedited, beginning to end, with supporting video and supporting animations to help teach what it is we're doing. Why don't we roll our animation about why herniated discs cause neck pain, why they cause even headaches that come from the neck called cervicogenic headaches. And why they cause
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at
Okay, well, we've just
www.
shown you on video why herniated discs cause pain because of inflammation. That inflammation is happening in a part of the disc that's in the back of the disc. We call it posterior. It's happening in something called the annulus fibrosus. It's a ring of connective tissue, and that ring of connective tissue normally holds the jelly in place so that the jelly in the middle of the disc, called the nucleus pulposus, doesn't squirt out whenever you lift things or play sports. Why don't you move out of the way? We're going to pull the fluoro machine out. We're done with it for now. We'll bring it back later. Nobody get near that fluoro machine. You got to be careful. So, Golba, you know you stay 2 feet. That's 24 inches away from anything that's sterile. Okay? That includes that surface there on the fluoro. And one thing you can do to help us is watch for other people accidentally bumping things that are sterile. And just if you see it, you say, hey, I think we have a problem here. Okay? All right. How you doing, Doc? Good. Hold on. Let's show everybody what we're doing here. Diego, take a look at this.
Yes, we can see it.
All right. So this is endoscopic surgery, folks. This is the future of spine surgery for degenerative conditions. The patient's face is here. Their neck is here. We're on the right side of the neck. And the chest is here. We've made a tiny 4mm incision in the skin, just wide enough to introduce the tube that we do the surgery through. This is called the tubular retractor. Many people think, oh, this is percutaneous, but it's not. Percutaneous means that the whole surgery is done through a needle. Okay? And there are percutaneous surgeries that are done. I'll show you. This is a needle. We use this in the beginning. If we were doing a percutaneous surgery, we would just put the needle in, take the stylet out, and we would put the laser fiber down the needle. Leave it. We just put the laser fiber down there and go zap, 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 done. But that's not what we're doing. We're doing a very sophisticated type of surgery. It requires tremendous skill and training, and it's not just a percutaneous surgery. This is requires actual visualization of the disc herniation and the tear in the back of the disc, which is what I'm targeting to fix. All right, let's bring the endoscope in, and we're going to let you come down with us to the bottom of this tube to where the herniation and the annular tear are. And you can share the experience with Deuk Spine and my team as we fix this person's herniated discs at C4-5 and C5-6. By the way, the last surgery is already going home, which is actually the hotel, because he's from Canada. He's doing fantastic. He doesn't have any more headaches. He doesn't have any more neck pain. He doesn't have any more arm pain. He has a little bit of pain in the back of his neck from the surgery being done, but he's not taking any pain medications, and he's very happy. Okay, this is surgery number 2 for today. Let's go ahead and fire up the laser, and let's start getting rid of these pieces of herniation. And what we're doing is, there's a herniation right there. We're using the laser to release pieces of herniation from the surrounding annular tear that they've moved through. What a herniation actually is it's the nucleus jelly pushing out through a tear in the back of the disc called the annular tear. If the tear wasn't there, the herniation wouldn't be possible. So all herniations start with an annular tear. And when the annular tear happens to be in the back of the disc, right where the nerves are, then you get pinched nerves, pinched spinal cord, headaches, neck pain, and those are what we're trying to fix today. So we're at the back of this disc, right where the herniation is, and that's what I'm working on, a herniation right there. You all see that? And the golden color that you're seeing is calcium. That's calcification, called dystrophic calcification of this abnormal tissue. On the left at 9 o'clock is the end plate, which is a bone of C5. And on the right side is there's a herniation right there. It just came out of the crack. Okay? So there's one down, one big one down. That was a good sized herniation, by the way. Here's more. I'm just going to float these out. If I can float the herniation out, it saves time. Anytime you can save time in surgery, it's always better for the patient because they're not under anesthesia for that amount of time you saved. You don't want to rush to make a mistake, but anytime you can reduce the anesthesia time, it's always better for the patient, much better. This is the back of that disc right here, right in the middle. And we're going to go off to the side because this patient's pain is primarily in their left arm. So we're going to go to the left foramen and we're going to remove the herniations in the left foramen. Okay? Any questions from our audience?
Yes, we have a question from YouTube. Our viewer asks, how long is the recovery for this surgery?
The recovery for this Deuk laser disc repair is 1 hour. Literally 1 hour. In 1 hour, this patient can pretty much go back to normal. There's no driving though today. They have to take a day off of driving, but they could go back to work tomorrow. Now obviously the work that they do has to be light duty. They can't be lifting heavy things. You want to give this disc a chance to completely heal. Let's switch sides. Switching over to the other side. But the recovery is basically 1 hour. It's the fastest recovery of any spine surgery in the world. The laser fiber is pushed back a little bit. The reason for that is, remember, it creates a pressure wave, so the pressure wave actually pushes the fiber backwards. The pressure wave is very useful with this type of laser. What's the name of our laser? It's SIS. SLS?
No.
SIS?
It's 550.
Is it luminous?
No, it's Boston Scientific.
No, the actual laser, not the fiber.
No, this laser, yeah, luminous. Yes.
Luminous. We use the luminous Homium YAG laser. That's the best. I used to use a Trimedyne a long time ago. Trimedyne hasn't really made much in the way of medical lasers for the States, and the luminous is a better laser because it has a 2-phase, and the second phase, 2 pulse phases. It creates a cavitation wave first, and then it comes in with the energy wave, with the light energy wave. Not light, but laser energy. So I find it to be very effective. I would not switch lasers. I really feel that the choice of laser is very important to do this type of surgery. You can't just go with any laser. You need to have a Homium YAG, and I would strongly recommend this manufacturer. I don't make any money from them selling lasers, but definitely, in my opinion, it's the right laser to use. Very safe. The tip of the laser, the energy where it's released, comes out about 0.5 millimeter, 0.5, and it does create heat. However, we use cold irrigation, and that cold irrigation really is important to dissipating the heat produced by the laser. That's a herniation, by the way, down there. It's all calcified and collagenized. I'm going to see if I can get some better visibility. We're pretty good, actually. The problem with the cervical scope, and the reason why these surgeries don't look as good as the lumbar, is that the cervical scope that we're using is something called fiber optic. And fiber optic scopes generally don't have as good visibility, clarity, as a rod lens, which is what we use for the lower back. But the nice thing about this scope is that it's very narrow. So we don't have a lot of trauma to the tissues as it passes by them in the neck. So, and there's not a lot of trauma to the disc because it's so narrow. The newer scopes, oh, that's a big herniation. Look at that guy. Oh yeah, come on. Anybody watching that new Korean TV show on Netflix, or that drama? I forgot what it's called. Huh? Not Squid Game. There's another one where there's these zombie monsters. It's very popular on Netflix. What's it called? Anybody know? It's on Netflix right now, very popular. Anyway, there's a scene where this woman is crawling through the air ducts and this monster is chasing her. So that herniation chasing my laser just reminded me of that scene last night that I watched. All right. Anyway, that's what happens when you don't ask questions. My mind wanders. Any questions from our audience?
No new questions, doctor.
Good. All right, why don't you show our audience what it is we're doing here? Why don't you run that animation showing that how the Deuk laser disc repair works for the cervical spine. Can you do that, Diego?
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.
Excellent. Okay, welcome back after watching our animation. We are working on still the same disc. It's the number 5-6, right, Luis?
Yes, sir.
And we're at the back of the herniation here. And this is all scar tissue from inflammation from the herniation. Normally I would, if I did an ACDF, I would be scraping all this stuff out with a curette, which is a type of surgical device with a scooping-like surface. And you can use the curette to scrape things out. I think that may be a little bit of dura down there, that white thing. That's where there was a piece of herniation just sitting there. These right here on the left are bone spurs that I'm working on right now. Again, this patient doesn't have a lot of bone spurs that need to be treated, but there are some. We've gotten rid of all the herniation that was over here. There's just a little bit of scar tissue left on top of the dura. And that's where all your pain comes from, by the way. When you talk about a herniated disc causing headaches, causing neck pain, it all comes from right here. All this stuff going on right here. This is all inflammation. And inflammation hurts. People with inflammation know. If you have inflammation in your knuckles, if you have inflammation in your feet, if you have inflammation in your knee from arthritis, all that inflammation hurts, hurts, hurts. Inflammation is painful. And unfortunately, most doctors have no clue that it is inflammation that causes neck pain and back pain. But it is, and that's what we treat here. We get to the source of the inflammation and we get rid of it, knock it out. And it's permanent. We do not do temporary fixed surgeries. These surgeries last as long as people don't re-injure their disc. You know, they got to give it a chance to heal. If you give your disc a chance to heal after surgery, you won't get, oh, that's a big herniation there. You see where that came from? That came from the neural foramen. That's the place where the nerve is. So that herniation right there could be sitting on that nerve, causing weakness, numbness. I don't know if I got it. Hard to tell. Maybe another piece of it. Let's see. The nice thing is we can always go back in and look with the endoscope. Careful. I have Luis assisting me. Oh, yeah, there's still pieces. Oh, there's a piece right there. Another one, if not the same. Oh, laser.
Hello, doctor. Do you have time for a question?
Yeah.
All right.
Yep.
We have a viewer on Facebook that wants to know, is it possible to fix a compound fracture at T11, T12?
Is it possible to fix a compound fracture at T11, T12?
Yes, sir.
But not with the laser. T11, T12 compound fracture, you're looking at, depending on whether there's disruption of the back of the bone, whether or not you need a kyphoplasty or you need an instrumented fusion. But I can't tell, to be honest with you, based on what you're saying is wrong. But it's very likely you'll need a fusion to fix that. So I would have to look at your films. But a laser will not fix a compound fracture. This would be the wrong surgery. This is for degenerative conditions like herniated disc, bulging disc, degenerated disc, I said, bulging disc, and herniated disc, as well as spinal stenosis from a disc problem, not from a fracture. But there is treatments for those kind of fracture injuries. They're very, very straightforward treatments. And we can perform that here at Deuk Spine if that's what you have. I've done fusions for many, many years. As a matter of fact, before I learned the endoscopic surgery, that's all I did was artificial discs and fusions. Fusions are fairly easy for us to do. We do them outpatient. You go home the same day. Hopefully I answered the question for them. This is a herniation right here. It's pretty big. It's stuck down really bad. Right on in front of the spinal cord. It's really stuck down to the posterior ligament, posterior longitudinal ligament. A lot of scar tissue. See how the endoscope is so useful? Because we're literally looking at the back of the disc. Normally a surgeon cannot see this unless you do endoscopic surgery. And since I'm the only surgeon in the United States that does this, and Canada, you're not going to find this anywhere else. But we do it all the time here. There's a herniation coming out of the foramen. So it's just, tedious work, but it's enjoyable because every herniation that comes out, you feel good that you're making an improvement for this patient. I'm just kind of studying the surface here. So our goals is to debride the annular tear, to get rid of the source of inflammation, to get rid of the herniation, to decompress the nerve root and spinal cord so we don't have any pressure on the nerve root or spinal cord at this level on either side. And you can see I can go from side to side, foramen to foramen. Okay? And the way we do that is like a windshield wiper type movement. I literally move from one side of the back of the disc to the other. It's pretty easy to do with a cervical scope. You can do it safely as long as you do it properly. But this is all scar tissue from this patient's herniation being here for so long, causing tremendous amount of inflammation. I'm going to go back to the other side. Take a look. Just about done with this disc.
Okay.
How are we doing over there? Do you guys need me to do anything? My shoes are still dry. Oh yeah, my shoes are still dry. So Diego, any questions?
Yes, we have somebody who says thank you so much for your input, and they're going to submit their MRI.
Oh yeah, why don't you put up the link for the free MRI review. So anybody out there that would like to get a free MRI review by me, Dr. Deuk Majin, you know, for yourself or for a loved one or friend, please use our link. We don't charge any money. It's a free service. Let me see if I can grab that out. We do it to help people, really, is what it comes down to. We're not about the money, we're about curing neck and back pain. Unfortunately, it does cost money to run the business, so we do have to take money at some point, but not for the advice. It's so hard for people to get good advice when it comes to their spine. There's so much misinformation out there. So the least we could do is at least straighten the record for you and let you know what is available, what's the best treatment. There's a lot of people, unfortunately, I see them out there in the Facebooks and the YouTubes, on social media, and they literally believe that there's no cure for their pain. And it's the furthest thing in the world from the truth. Their pain can be cured. They just need to go to the right doctor to get it cured. That's really what it comes down to. Oh, nice. Another herniation. We've taken quite a few out. I've counted at least 10. What have you guys counted? There's another one. I think we're more around 15 to 20 at this point. But these are herniated discs. That's exactly what that is. And they sit around the back here, right next to the spinal cord and nerves. They get up in their business. Yeah. There's a little wad of scar tissue there. You see that? You can just see it. All right, we're just about done here. I need about 30 seconds more. I've gotten rid of bone spurs. I've gotten rid of herniation. I've gotten rid of scar tissue. I'm very happy with the progress we're making. And I'm going to wrap this one up because we're pretty much done. And then I'm going to go and work on the next disc. Let me flip this. What flipping means is I'm turning the endoscope and looking the opposite direction. I think I have a little more work to do right there in that foramen. It's a bunch of scar tissue stuck up against the nerve root. And you just got to be careful, right? You don't want to gild a lily, as we've talked about so many times. This is very dense scar tissue. This comes from years of inflammation. This did not happen overnight. This is like a lot of inflammation and bone spur right there. I have somebody watching our surgeries who says to me, Dr. Deuk, I've got bone spurs. Well, everybody has some degree of bone spurs. We only get rid of what we need to, because the more you mess around with things that don't need to be messed around with, the more problems you create as a surgeon. We don't want to create problems. We want to fix these people's problems, not give them new ones. So I do fix bone spurs when it's needed, but I don't go after bone spurs when it's not. And you learn through experience when it's needed and when it's not needed. Whoa, easy.
We have a question from Facebook.
Last check on the other side and we're done here. Yeah, I'll take the question.
Does Medicare cover this procedure?
Does Medicare cover this procedure? No. Medicare does not cover any new surgeries. Medicare doesn't even cover artificial discs. And this year, Medicare stopped covering cervical fusions in most patients. So Medicare is cutting back on what they cover, not giving more coverage. They're actually cutting back and taking away coverage. So Medicare doesn't cover a lot of spine surgeries. Yeah. You know, what's amazing is Medicare is really poor paying insurance, but surgeons take it anyway because it doesn't require prior authorization. So you don't have to like submit records and talk to a peer reviewer and go through a bunch of hoops. You just go do the surgery. But for the first time ever, Medicare is now requiring prior authorization. This is the very first of anything, whether it's drugs, whether it's surgeries, whether it's treatments. The first time Medicare has ever required a surgery to be prior authorized is ACDF. They're trying to cut back on care. They don't want to pay for people's care. Huh? No, they don't make you prior authorize PCDF. You can do a PCDF. But it's just a matter of time before they're not going to pay for anything. Because the people don't stand up against the insurance companies. They just let the insurance companies do whatever the insurance companies want to do. What do you think a bully's going to do if they keep stealing your money and you don't stand up to them? They're going to keep taking more and more. Next thing, they're going to come and take your car. They're going to take your books. They're going to take whatever they want to take because you're not putting up a fight. People have no clue that the bully is the bad guy unless you teach them what a bully is. And the insurance companies, they actually make more profit when they don't pay for surgery. So anytime they can get out of paying for surgery, they're just going to be keeping more of that money as profit that you pay them in your premium. People don't understand that. They're like little sheep. And they, instead of a shepherd, they've got a wolf leading them. a wolf who just gets hungrier and hungrier all the time. And then they complain to me because Medicare doesn't pay for the laser. It's like, you're letting Medicare not pay for the laser. Do something about it. It's not my job to fix your insurance. It's your job. Medicare doesn't care what the surgeons say. It's only when the people start complaining that they'll actually listen. Sorry, Medicare people, but you're stuck in a sinking boat, and unless you do something about it, and I can't fix it for you. I have the fix, but you gotta go get it and make it apply. Shot? And I may actually sound that I'm not empathetic to people who have insurance that doesn't cover the treatments that they need. And it's not that I'm not empathetic. I am empathetic. It's just that it's your guys' problem to fix, not mine. You know, we scientists come up with the best treatments in the world. We should be applauded and not criticized because your insurance won't pay for it. That's your problem. All right. 2, 3, 4, 5, 6. So we got 4, 5 is next. Everybody agree?
Agree, sir. Yes, sir.
Yeah. All right. So what it comes down to, Medicare people, is are you just going to sit around and wait for Medicare to take everything you need away from you? Or are you going to do something about it? Hey, if I had herniated discs in my neck and I was faced with a highly invasive fusion versus the laser surgery that my insurance didn't cover, I would definitely do the laser surgery. I just pay out of pocket. It's important enough to me because I've seen the complications that happen with fusions all over the country, all over the world. They're horrible. All right, let's get an AP. Wait. Quickly. Is that it there? It's not bad. All right, lateral. I need a better AP. Give me a better AP. Trying to line up the spinous processes. Try to get it nicer. That's really good. So we're pretty close to the middle. All right, let's go ahead and go back to a lateral. So those lines you can see on that front back view, obviously there's the coker and there's the dilator I'm holding, but there's also two squiggly lines. One is the endotracheal tube, the other is the esophageal temperature probe. And I like using an esophageal temperature probe because it's easier to deflect the esophagus when it has something hard in it. Shot. Okay, here we go. I'm going to make a move for north. Pretty easy. Shot. That's perfect. Now let's get an AP. By the way, we've lost 1 drop of blood the whole surgery. Compare that to a fusion, folks, where they're losing 200 milliliters to 300 milliliters of blood. Each milliliter is 20 drops. So multiply 200 times 20. I need a true AP. You're not giving it to me. That's pretty darn close. So I need to come a little bit to my side. Shot. That felt good. Lateral. Right in the middle there. Yeah, this is the best surgery for you, whether you're a Medicare patient or not. And from my standpoint, if you want this surgery as a Medicare patient, you're going to be paying out of pocket. The good news is that we do offer discounts for Medicare patients. Shot, so it can help you get the surgery you need. Shot. Shot. All right, now 2, 3, 4, 5. We are at 4, 5. Everybody agree? All right, good. That is the next disc we're fixing. Shot. Shot. Good. All right. So I had to clean out the material inside the dilator. And now we're going to do a discogram. Ooh. Did I get you? Sorry about that. Shot. Oh yeah, perfect. So that was a good one. That's a discogram. Show them the herniation. All right, take a look here on the x-ray, folks. You got the white arrow showing the herniation. That's it, that black thing. So that's dye going around the herniation. That's good, thank you. And let's get an AP. Coker. So that's a lateral view or side view. There's a little bit of a double shadow on the back of the vertebral body, meaning we're not perfectly oriented lateral. We're a little bit off by about 2 degrees. That's good. Now show them the tears on both sides in the back of the disc, the annular tears. So she's going to show you on this x-ray. Keep it on the x-ray, please, guys. Diego. Yeah, show them the tear that goes towards, there you go. That's one tear on the left, and there's the tear on the right. And the little black thing, like the dot over there, is the nerve root. Show them the nerve root. Yes, that's the nerve root. Right there. Yeah, that's the nerve root. All right, let's go back to a lateral, please. So again, all of this 2 disc herniations fixed with 4 millimeter 1/4 inch incision. No blood loss, no fusion, no metal, no artificial disc, no hospital, all outpatient, no pain, virtually no pain after surgery. Patients take Tylenol, no narcotics. Shot. Shot. All right, and our patient here is from where? Isn't he from Puerto Rico? Puerto Rico.
Yes.
Wonderful. So you're probably related. I'm just kidding. I got a good laugh out of Luis. All right, the whole surgery is going to be done with this little tube. But this patient is from Puerto Rico. Most of our patients are international or out of state from Florida. Shot. Because the international patients are smart. They get online and they Google and they find out who's doing the most advanced surgery in the world, and they're willing to travel for it. So he's from Puerto Rico. He came here with his lovely wife, and they've been watching all my surgeries for a little while, and he knew he didn't want to have a fusion. So he came here. Shot. Yeah, perfect. You can see the tip of the dilator is right in that herniation. We don't want it to go any further. So, Luis, will you keep an eye on that tip of the dilator for me, okay?
Yes, sir.
Shot. Shot. Okay. So I'm sliding through the disc. Remember, the disc is mostly water in the center part, the jelly. And so the water doesn't care if we're passing through it. It's just like if you dive into a swimming pool. When you're done, the water looks the same as when you started. Unless you're really fat like me and half the water goes out of the pool. That was supposed to be funny. You guys are allowed to laugh at things like that. Shot. Okay. I'm very proud of my plus size, in case you couldn't tell. Shot. My wife reminds me all the time. She says, "You're obese." Oh God, yeah. Are you kidding me? My wife, she's this tiny little Korean woman, but she's got a tongue like a laser. Listen, she's very sweet, don't get me wrong, but she has no problem calling things for what they are. I always say to her, I may be obese, but I'm not morbidly obese. You know, it could be worse. I could be morbidly obese.
Yes. Yeah. All right.
But honestly, it's due to her damn cooking, you know? What am I supposed to do? She can cook really good. She makes delicious food. Oh, she loves cooking everything. She'll cook Armenian food at times. She'll cook everything. Mostly, you know, American dishes.
Scarf on, please. Lights off, please.
She's always sticking kimchi in her mouth while she's cooking me and my kids like beef stroganoff, you know. She'll cook German food while she's munching on kimchi. Yeah, yeah. She knows what we like. All right. So we are now at C4-5, and we're at the back of that disc herniation. And once again, we'll use the laser to remove some of this herniated material. And the main thing we're doing, folks, is called an annular debridement. That's why Deuk laser disc repair is different than other surgeries. We're not just doing a discectomy, we're doing an annular debridement. Other surgeries don't do annular debridement. Have we shown, Diego, have we shown them the Deuk laser disc repair animation during the surgery?
Yes, we have. I can show it again.
And you've already done the causes of neck pain video?
Causes of neck pain as well,
Why
yes.
don't you do a comparison to a fusion?
Okay.
Let's run the comparison video while I work on this disc with the laser.
Understood.
Show them, you know, the difference between Deuk laser disc repair and ACDF or an artificial disc, basically.
All right, gotcha.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published.
1.
Okay, welcome back after watching that comparison video of fusion with laser. I'm pulling out a pretty big herniation right now at C4-5, and we're going to be done very soon. We've gotten pretty much all the herniation. I think there's just a little bit left. So I'm just telling my anesthesiologist to get ready to wake him up. Again, herniations, for those of you who don't know, are usually in multiple pieces. When I say usually, I mean virtually 100% of the time. Herniation is not just one big piece. It's usually in multiple pieces, because the reality is, laser please. The reality is that herniation, happens multiple times throughout people's lifetime. Once you get a tear, an annular tear, then you've created a pathway for the nucleus to come out, right? And so of course you're going to get more than just one herniation, because you now have a door open, and that's just going to allow more material to come out of the disc and herniate. So for this one, the last disc, I think we counted around 20, right? There's a big one. That's a big one right there. I'm going to go after it with a grabber. And once they're freed up, these herniation fragments, you can actually go after them with the grabber. Nope. Yeah. You're right. Steve Irwin, I love that guy. His wife and kids are now doing the show from the Australian Zoo. Oh, there it is. I gotta get that thing. Huh? Yeah. Yeah, she's quite beautiful too. I know. I remember when she was a baby. All right, let's get the light on here.
Lights on, please. Lights on, please.
Let's show our audience this herniation that I just pulled out.
Okay.
Can you guys see this?
Yes, we can see it.
You see it?
Yep, I'm zoomed up to it.
So this is the grabber. It goes down the tube and it can grab out little chunks of herniation like this one. Can you see that?
Yep, looking at it right now.
That's what I just did. I just grabbed it and pulled it out. So I give this to Luis and he will deliver it to the pathologist. We're just about done here. Just need a few more minutes and we'll be finished. All right, we need the light back off, lasers on.
Lights off, please. Thank you.
So when I go to Los Angeles, I think it's January or February, for this meeting that I've been asked to present the Deuk laser disc repair surgery, they want me to do a cadaver lab. Cadaver labs in medicine are where you teach surgeons your technique, not in an operating room, but with a person who's donated their body for science, and we use those bodies to teach surgeons. Just about done. There's another piece of herniation right there. Grabber. I think I got it, but I'm not sure. It's pretty cool because this meeting will have the U.S. military will be involved, because it's a technology meeting, advancements in basically neurosciences. And they're going to have DARPA there as well, scientists from DARPA. So it's kind of a technology, high-tech advancements in spine and neurosurgery and neurosciences, memory, neurology. It's not just neurosurgery. It's basically an opportunity for the military to learn about the newer technologies that are available in neurosciences, to see if there's any applications that the military can use, which is actually good. All right, I think that we are pretty much done here. Say hello to my little friend. That guy is really misbehaving. Got it. We're done. Well, right there. That's it. All right. Thank you, everyone. Great job. We'll show everyone what we're doing here. Turn the scope off, please.
Monica, please.
I'm going to put a little antiseptic
Stand by light.
and that's called betadine, developed at NASA. Best antiseptic we have.
33, please. Thank you.
Now the whole surgery, these 2 disc herniations were fixed with this 1/4 inch incision.
Yes, Monica. Yes. So these connect and then I connect on the other side.
And let me show you what I'm talking about. All right. Can you see this? Let's get the light on.
Yep, we see it.
All right, so this is the patient's chin. Their face is here. They have a tube down their lungs, breathing for them. They're completely asleep. And the whole surgery was done through this little metal tube. This is in place of artificial discs and fusion. This patient did not want an artificial disc. They did not want fusion. Most people don't want metal in their neck. They don't need to have it. We can fix degenerated discs, herniated discs, and bulging discs. We can cure neck pain, headaches, arm symptoms, even myelopathy, which is spinal cord compression. We can treat that, spinal cord dysfunction, with surgery using the Deuk laser disc repair. Take a look at this incision here. Do you see it?
Yes.
Okay, 4 millimeters, folks. Bam, no blood loss. I think we lost like 2 drops of blood. We'll call it 1 milliliter or half a milliliter because that's 10 drops. Any questions, type them up. I'll be happy to answer them for you. I'm going to head over. In the meantime, if you want to type up your questions, I'll be happy to answer them. And go ahead and run a video for them to watch till I get there. I have a very special patient sitting here next to me who's traveled all the way from Tennessee.
Yes, sir.
With his family for one purpose, and that is to get his neck fixed.
In the wild, I've trained animals for 25 years, not jumping through fiery hoops, but just mostly behavior, no, come, just a few words. We had 52 big cats, tigers, lions, leopards, cougars, lynx. This is me about 6 years ago in the tiger cage. And this guy here, we raised him from a baby.
That's special.
I'll tell you what, the special part is being here.
And how long have you been dealing with this problem with your neck?
It's come on in the last 8 weeks strong, but after I start thinking about it, even 6 months ago, I was seeing things happen that I couldn't understand why. And I just want to get back to somewhat where I was at and getting the feeling back in my hands, my stability, a little strength where I can get this boy up.
Well, what's going on, as we've talked about, is you've got these herniated discs, bone spurs in your neck that are pinching down on your spinal cord and nerves. And I'm going to go in there tomorrow with a laser, and we're going to open all those spaces up, get the pressure off the spinal cord and the nerves, so you can start getting some feeling back and strength back in those arms.
That sounds great. That's why I'm here. Then I've researched, and I kept coming back to you all and seeing the testimonies and seeing, watching hour after hour after hour of the surgery. And that says a lot if you can do it live on Facebook. It's just a pleasure to be here. I feel safe. I feel like when we arrived last night, we drove up in front of the place, And I told my crew and my wife and my driver, I said, we have arrived. We have arrived. Thank you so much.
We'll see you tomorrow morning, all right?
I appreciate it so
All right,
much.
so we did surgery yesterday with the laser. Everything went really well. You can actually see the 4mm incision right there, 3 discs. He didn't want fusion, and so he found Deuk Spine Institute and he came here.
After the surgery, when I talked to her, I was still a little bit drowsy. And 4 hours later, we were sitting over at a restaurant, seafood restaurant, eating seafood, and I could clap my hands at the baby because he claps when he does something good. And I could clap with him without missing my hands.
And you're already getting strength back in your arms and legs. You're getting control of your bowel and bladder back again. That's great news. It's a great sign. I think you're going to keep improving and hopefully get you back to normal.
You are the best. That's why I'm here. That is why I'm here. It is amazing. From the time I walked into this place, I felt at home. I felt like I was with friends all the way through surgery. When we walk into this surgical room, everything's so clean. I feel like I'm in a dream. I really do. Thank you so very much for what you've done.
You are welcome.
Hello, everyone. Welcome to the Deuk Spine Institute YouTube channel and Facebook page. We are waiting for Dr. Deuk to make it over from this operating room. Meanwhile, we will have another video playing here about one of the testimonials of our surgeries. Again, we have a 98% fully elimination of pain here at the Deuk Spine Institute with the laser surgery. It's not like anything maximally invasive like a fusion. But again, we have Dr. Deuk coming on his way. Make sure to type up your questions for Dr. Deuk. He will love to answer anything that you have regarding surgery or just your spinal health. Just remember to download the Deuk Spine Institute app. It's really great. You can watch live surgery and find out more about your spine. Meanwhile, here we'll just watch another video about one of our testimonials from our former patients. Thank you so much, guys, and Dr. Deuk is on his way. Thank you.
Let's get started. I'm Dr. Deuk Majin. We're here with one of our patients who traveled to here from Texas, correct?
No, Auburn, Alabama.
Sorry, Alabama. All right, so Alabama. And why did you come to Deuk Spine Institute?
Because the last flare-up of L4 that ruptured in 1999 was unbearable, and my wife can be a testament to that. Who took care of me for 10 days, crying on the floor with an amazing, incredible pain.
Okay. And you've had that pain now in your lower back for 22 years?
Yes.
You've tried physical therapy and exercises, stretching, but none of those things worked.
No, temporarily.
Yeah, and where was your pain coming from? Do you know?
It was around the belt region in the back, yeah.
So the L4-5 and L5-S1 discs had tears and they had inflammation and pain. He also had sacroiliac joint inflammation and pain. And Dr. Patel standing here, which we don't get to see you very often, but Dr. Patel was a hero. He came in and did the bilateral SI joint injection.
Yep.
So do you still have the pain in your back that you came here with?
No.
It's gone.
It's very, very gone, yes.
Excellent. Well, it should stay gone. Is there anything you want to say to your audience?
Well, I think more people should come and start looking at this procedure, finding the website, learning about what are the things that needs to be done, such as sending the MRI, and trust on the incredible treatment and experience that I have received from this team. It's relatively impressive, very impressive. And I would recommend it to many of my friends who play golf and has been suffering for a long time.
All right, very good. Well, have a safe trip home.
Thank you, sir.
Finally, this is 1 hour after my procedure, and I am
turn a little stiff, and then I'm gonna walk around, and so far so good. I feel very, very pleased. 24 hours after the procedure was performed on me on L4, L5, and S1, the L4 injury has been there for 21 years and has never give up and has made my life miserable. And the initial injury occurred because I have congenital issues inherited from my father, who suffered tremendous sciatic pains, and all my five brothers also have the same issues. So this is only 24 hours after. I already walked a mile this morning, and I only have taken 1/3 of the indicated medications, and I still have no pain, with considerable improvement over 3 or 4 major landmarks. The first one is pain down the leg, the right leg, where the main injury occurred, as well as pain on the left and the middle of the back for the 2 main new discs that were also injured, the L5 and the S1. So I recommend this procedure to anyone who, like me, has suffered for many years and were afraid to the pain that is inflicted with some other technologies that basically requires months for rehab. And I will not hesitate to submit myself to another procedure if it's needed, Dr. Deuk's Spine Institute. So I thank everybody for all the service, outstanding service, medical and social.
Hi, Dr. Deuk here, and we've just finished the second for the day of anterior cervical endoscopic Deuk laser disc repair. Our first patient had a herniated discs at C5-6 and C6-7. The second patient had herniated discs at C4-5 and C5-6. We've just completed 2 surgeries. Both of them went very well. I didn't have any issues. If you watch the surgery, you could see that we were in the back of the disc where there's a tear, and I could see from side to side in the back of the disc. And the reason I can do that is if you take a look at, and this is a model, by the way, created by a good friend of mine. He's up in Canada. His name's Jerome Fryer. And basically, he creates the absolute best spine models, period. I've had this model for about 10 years. I actually designed the model, and he built it. And the model shows stuff that's quite unique. If you look inside, you can see an annular tear in the back of the disc because the vertebral body is clear, and you can see the annulus is the white thing, and you can see annular tears, but the one in the way back there is a through and through tear, and basically you can see the nerves, the little yellow things, and the red is the blood vessels. And if you push on this thing, you can actually push some of the blue stuff, the nucleus, through the tear. And let me see if I can show you that in the foraminal view. I'm going to move the nerve root aside. You can see the tear back there, right? And then if you lift something heavy, look what happens. The jelly comes out, right? That's what happens with herniations. You first get a tear, and then you pick something up, and then it pushes the jelly out. Well, that jelly just sits there, wedged in there most of the time, causing pain and inflammation. Yeah, so what we do in the Deuk laser disc repair is, rather than, like other surgeons, we don't need to take the whole disc out just to get to the part in the back that's the problem. I actually go through the disc with a little tube. I get to that part in the back where the tear is, and I use a laser to clean the tear. And that's what you saw today. So the reason I can go from side to side is I go in the middle with the tube, and I can actually sweep side to side, and that's what I can do with the cervical. Can't do that in the lumbar spine or thoracic spine, but we do it in the cervical spine. It works quite well. Thank you, Diego. Do we have any questions from our audience?
Actually, we don't have a question, but we have a very special Merry Christmas from a longtime viewer. also thank everyone at the Deuk Spine Institute for excellent care that she's received every time that she's came in for treatment. She hoped that everyone enjoyed her delicious cookies that she sent in appreciation for last week.
Yeah, we did.
And a Happy New Year.
Liz, thank you so much. We did enjoy your cookies that you sent. The whole staff did. We had 2 boxes of amazing cookies. I think we still have a few left. I personally enjoyed the mint cookie, chocolate mint. It was amazing. But thank you very much. The staff really appreciate the generosity, especially in the holiday season. So we don't have any other questions. I'm Dr. Deuk Majin. I just want to tell you, go check out our app on your phone, download it, it's free. The Deuk Spine Institute app in the App Store. And the Deuk Spine Institute app has a lot of really good information in it. It talks about conditions of the spine that are common, that cause pain and dysfunction, and also state-of-the-art treatments that are available for those things. Deuk Spine Institute takes patients from all over the world. Whether or not you have insurance, we accept patients and we treat patients from all over the world for basically painful spine conditions involving the neck, thoracic, or lower back. You'll find state-of-the-art treatments, the best treatments in the world here. And yeah, we look forward to helping you or anybody that you know that might have back or neck pain. We do a free MRI review, and you can actually go to mri.deukspine.com and use that link and that website to upload your MRI, fill out a few questions about your pain, and then I personally review all the MRIs myself, and we set up a quick virtual visit with you where we can actually answer questions and talk about what's wrong with your back or neck and why you're having pain and what can be done to fix it. What I'll tell you out there is this. There are many people out there that believe there's no hope for them. There are many people out there that have been told by their surgeon there's no need for surgery, when in reality there is. People think I'm surgery happy, but I'm not. What you have to understand is the need for surgery is not determined by the amount of time you've had the pain. It's not determined by the severity of the pain. It's not determined by whether or not you've done physical therapy or other treatments. The need for surgery is determined by the cause of your pain. And if the cause of the pain is coming from an annular tear with a herniated disc or bulging disc, there is nothing else that will take that pain away except for surgery on the disc, specifically the Deuk laser disc repair to repair the tear. If you do the surgery, your pain will go away because we're addressing the source of the pain. On the other hand, if your pain is coming from the facet joints, and just so you're clear, there's a difference between a disc and a facet joint. Actually, let me use this model. It's a little bit clearer to see. The disc is that cushion between the bones. It's the most common cause of neck and back pain. The facet joints are a separate type of joint back here. It's between the bones. It's a diarthrodial joint. Whenever your spine moves, the facet joints move. When you have pain from a facet joint, laser surgery on your disc will not fix that pain. You have to do a treatment on the facet joint. The best treatment in the world right now for that is a procedure where we use an endoscope to go in and basically cut the nerve to the facet joint. It's a endoscopic laser-assisted rhizotomy. It's only available in a few places in the world. Deuk Spine Institute is one of them. This is a technique I learned from Dr. Anthony Young over at Phoenix, Arizona. Dr. Young is a pioneer in endoscopic surgery in the world, and Dr. Young taught me personally how to do this procedure years ago when I visited his facility in Phoenix, Arizona. I met with his son and him. Both of them are spine surgeons. And I was fortunate enough to learn not only how to do endoscopic surgery of the lumbar spine, but also rhizotomy of the lumbar facet joint. So this procedure works fantastic. It's the way to go. All right, hope you enjoyed our broadcast, and we'll be back again in a few hours for another cervical Deuk laser disc repair. We're going to be doing another procedure in another room, which we don't have broadcast ability. So we won't be able to broadcast from room 2, but we only broadcast from OR3.